Iraq poison grain disaster, the 1971 to 72 methylmercury outbreak. The purpose and the objectives. This presentation explores the Iraq methylmercury poisoning outbreak, which is the largest mass mercury poisoning in history. Through data driven visuals, it highlights how a public health tragedy unfolded and what the world learned from it. Objectives: explain the cause and spread of mercury poisoning outbreak, visualize key data, interpret the impact through charts and demographic insights, highlight lessons that influence modern food safety and chemical regulations. Table of contents. Background and the cause. So, what happened? In 1971, there was an outbreak caused by the consumption of seed grain treated with methylmercury fungicide, which was strictly intended for planting. The wheat and barley were imported from US and Mexico for agricultural use. A poor harvest and delayed grain shipment left rural families desperate. They ground those seeds into flour and started consuming it as food, fed it to the animals, and even discarded it in the rivers. They did have warning labels on it in Spanish, English, and they did even have skulls and crossbones, but the local Iraqi farmers didn't understand it. The red dye was often washed off, giving the illusion that the grain was safe to consume, but the mercury still remained. Timeline of events: in September to November 1971, the grain shipment had arrived, but it was late for the planting season. So, from October to November, the farmers had already done their sowing and they started consuming those grains. They washed off those dye and started consuming it. On December 21, there was the first hospital admission. On December 26, the doctors raised an alarm and government began public radio warnings. On January 1972, there was the outbreak was at its peak. Thousands of people were hospitalized. Several hundreds of new cases were observed daily. Army enforced a grain ban and WHO experts had arrived. On March 1972, there was a sharp decline observed. 90% of the cases occurred by the end of the February and then it gradually reduced due to the grain confiscation or consumption. On March 27, the last case was observed, and later there were different conferences conducted internationally to understand this outbreak till 1974. So let's understand the geographic spread of the outbreak. The most affected areas included Al Mufthana and the surrounding provinces. The rural provinces saw dramatically higher incidence rates, while urban areas remained unaffected due to their reliance on government inspected flour. Epidemic curve, monthly hospital admissions and deaths. The outbreak peaked in January 1972 with over 3,000 cases and the highest number of deaths. Over 90% of all cases occurred in January and February and declined sharply by March. The 2 to 5 weeks latency of methylmercury explains the grain eaten in November to December, which led to the January spike. The outbreak was effectively contained within 3 months with zero new admissions after March. Demographic impact: age based distribution of cases. Children under 10 made up nearly one third of all the hospitalizations. Infants were less likely affected due to breastfeeding. Pregnant women faced higher fatality rates, 31 were hospitalized and nearly 50% died. The methylmercury crossed the placenta and harmed the unborn babies. Patient outcomes and case fatality rate. The total hospitalization cases observed was 6530. 459 deaths occurred, which helps us understand the 7% case fatality rate. 93% of them survived but had long term neurological effects. Survivors contributed to major advances in mercury toxicity research. Most patients survived, early care made a major difference. Symptoms of methylmercury poisoning: the early or mild symptoms include tingling or numbness in hands, feet, or lips, headaches or lightheadedness, fatigue or reduced concentration, nausea or abdominal discomfort. Severe or neurological symptoms include loss of coordination, impaired vision and hearing, slurred speech, muscle weakness or tremors, cognitive decline, memory loss, seizures, or coma. The high-risk population included infants and unborn babies. Mercury crossed the placenta, harming fetal brain development. Exposed infants may develop delays or cerebral palsy-like symptoms. The aftermath and the lessons learned. Scale of disaster. It was the worst mercury poisoning outbreak in the history. The swift public health response was observed as the outbreak was contained in under 3 months due to grain ban, public warnings, and global aid. The regulatory changes were observed as WHO and FAO panel led to bans on mercury fungicides, improved labeling, and safety standards. This also sparked creation of poison control centers and rural education on chemical safety. This also led to scientific insights as the Iraq data confirmed that mercury passes from mother to fetus, shaping the modern pregnancy guidelines and global food safety limits. Summary and global legacy. This was caused by the consumption of mercury treated grain intended for planting. The cases spiked in January to February 1972 due to grain consumption and mercury's delayed onset. Children and unborn babies were most vulnerable to long term effects. The tragedy triggered global policy change and advanced our understanding of mercury toxicity. This legacy lives on in international food safety and standards protecting future generations. These are the references which we used. Thank you.